In today's video, we will learn about the autonomic nervous system, the part of the nervous system that manages involuntary functions. The autonomic nervous system controls involuntary activities such as heart rate, digestion, respiratory rate, pupillary response, urination, and sexual arousal. It works below the level of consciousness to maintain homeostasis. It works through its three functional divisions: sympathetic nervous system, parasympathetic nervous system, and enteric nervous system. The key features include involuntary control, two neuron pathway, that is preganglionic and postganglionic neurons, motor and sensory components. Sympathetic nervous system, the fight or flight system, prepares the body for emergency responses. It originates as thoracolumbar outflow from T1 to L2 spinal segments. Preganglionic neurons are cell bodies in the lateral horn of spinal cord gray matter. Preganglionic fibers exit via the ventral roots, enter white rami communicantis, and reach the sympathetic chain comprising paravertebral ganglia. Postganglionic neurons are present in the paravertebral ganglia, which forms the sympathetic chain along the vertebral column, and in the prevertebral or collateral ganglia, for example, celiac, superior mesenteric, inferior mesenteric for abdominal organs. The neurotransmitters which help in the communication across synapses include: all preganglionic neurons secrete acetylcholine, which acts on nicotinic receptors. The postganglionic neurons secrete nor-epinephrine, which acts on adrenergic receptors, which are alpha and beta. Effects of the sympathetic stimulation are many and shown in the diagram on the right side. These include increased heart rate and blood pressure, dilated pupils, bronchodilation, inhibited digestion, sweating via cholinergic fibers, mobilization of glucose and fatty acids. In this slide, there is an illustration showing the process of stimulation of adrenal medulla that makes it release adrenaline that further acts on adrenoceptors, indirectly mediating or mimicking sympathetic activity. Parasympathetic nervous system, the rest and digest system. It conserves energy and maintains daily bodily functions. It arises as craniosacral outflow, including cranial nerves 3, 7, 9 and 10 and S2 to S4 spinal segments. Preganglionic neurons are cell bodies in the brainstem nuclei or sacral spinal cord. Preganglionic fibers are long fibers traveling to ganglia close to or within the target organs, whereas the postganglionic fibers are short fibers from ganglia to target tissues. Neurotransmitters used in the parasympathetic system: both pre- and postganglionic neurons release acetylcholine. Postganglionic acetylcholine acts on muscarinic receptors. Effects of the parasympathetic system are many and shown in the diagram on the right side. These include decreased heart rate, constricted pupils, bronchoconstriction, stimulated digestion, and gland secretion, urinary bladder contraction. Enteric nervous system, known as the second brain, it controls the gastrointestinal system's motility, secretions, and blood flow. Located within the walls of the GI tract, consists of two main plexuses: myenteric or orbex plexus, which controls GI motility, submucosal or Meissner's plexus, that regulates secretion and blood flow. This system can operate independently but is modulated by sympathetic and parasympathetic inputs. There are some clinical implications when any of these systems do not function properly due to any illness. Horner syndrome, loss of sympathetic innervation to the face, leads to ptosis, meiosis, and anhidrosis. Autonomic dysreflexia, seen in spinal cord injuries above T6, causing uncontrolled sympathetic response. Orthostatic hypotension, failure of sympathetic vasoconstriction when standing up. Key takeaway: the ANS is essential for maintaining internal homeostasis and adjusting bodily functions. according to internal and external environments by balancing sympathetic, which is alert or energy consuming, and parasympathetic, which is rest or energy conserving activities. Thanks for watching. Stay curious and keep learning. Subscribe the channel and follow us for more high yield medical videos.